I think one misunderstanding is that patients and families think they have to stop everything if they come onto hospice. That the hospice nurse will come to the house and throw out their heart medicines, their blood pressure medicines, and make them get into bed, and that's not hospice at all. And I think many times people think on hospice the focus is on dying, and that's not it at all. Really the focus is on living.
Patients and their families invite us into a very sacred place at a very special time.
There was one point, I think there were about 20 of us in the room. The ability for people to come in and to see him and to talk to him and to hold his hand.
Patients themselves are worried about two things: pain and their families. And when they come to the inpatient unit, they know that we will relieve their pain and we will take care of their family.
My husband was diagnosed on New Year's Day with lung cancer, and approximately 3 days later, he wound up becoming paralyzed with a tumor on his spine.
Some of those patients may transition into our inpatient unit, the Hulitar Center. And that's a center where patients can get a higher intensity of service without going to the hospital. Although in many ways it's staffed, in a similar way to the hospital, where you have similar ratios of nurses to patients. Each day there's a social worker on the unit, a chaplain on the unit, a physician making rounds in the unit. So in some ways it's similar to the hospital, but in other ways it's very different than the hospital.
We don't have overhead paging, we don't have the chaos that occurs in the hospital. We also have private rooms without any visitation restriction.
The nurses are amazing. They speak to them so kindly, because I truly believe my mom can still hear me. And so you need those kind of nurses here to give that compassion and that comfort. And they give it to us too.
Well, a patient and family are usually met by the nurse and the hospice aide. We discuss their goals of care. It could be a good night's sleep, it could be pain management, respiratory management. We have had weddings happen on the IPU, as well as graduations. They can bring in their cats, their dogs. We've had bunnies. We do meet the goal of the patient and family as best as we can.
The hospice benefit is a benefit under Medicare, and people have access to that oftentimes much sooner than they do access it. If you think you or your loved one may be ready for hospice, call us. If you're eligible for hospice services, we can get them started right away.
Don't hesitate to send your loved one into a hospice facility, because you want a safe journey home, and everybody deserves that and wants that. You will be ever so grateful that you took the step.